COVID in Connecticut, once again with Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir. Glad to have you back in studio with us. Trying to make sense of where we stand. It looks like cases, this wave is starting to go down. Not exactly dropping like a rock. Numbers went down over Memorial Day weekend, then almost started to creep back up again last week before they dropped again yesterday. What is your sense for where we stand?
So that's right. It's encouraging. The Northeast started seeing an uptick in cases early on compared to the rest of the country. Now, there are other parts of the country, such as Louisiana, Alabama, that are continuing to see an uptick in cases. But here in the Northeast and Connecticut in particular, we've seen a downward trend in terms of both positivity rates and also hospitalizations, and I believe that trend will continue.
Yeah, and while those peaks of this wave, certainly not high, I'm just curious what we can learn because, Doctor, at least from what I've seen anecdotally, this was the first wave out of all of them where most people were not really taking maximal precautions. So this might be a good dress run for how we're going to approach future waves. What, if anything, do you think we learn?
Absolutely. So a few points that viewers need to keep in mind. First and foremost, I always say this, get vaccinated. If you're eligible now for the booster, whether it's the first or second booster, depending on your eligibility, please get that as we head into summer.
Right.
And then also look at your risk profile. If you're a high-risk individual, and by that I mean if you have underlying medical comorbidities, if you're above the age of 65, it's not a bad idea to wear a mask in an indoor crowded setting at an airport or an airplane. I just got back from an overseas trip and everything went fine, but I did stick to masking. So it's those things that people need to keep in mind. And the other thing is the virus has continued to evolve where it's likely causing less severe disease.
Yes, it's still spreading very well, but what masking do you suggest? Obviously N95, KN95 is best, but would you say you got to go that route or just any mask?
A 3-ply surgical mask will do. N95 is the gold standard, but to be honest, I haven't worn an N95 on my travels. I was using a 3-ply surgical mask.
3-ply. Let's talk about COVID antivirals. Paxlovid. We keep hearing over and over that it is in abundant supply, but I have seen just from people I know and from other news reports that sometimes people are having trouble getting their hands on it because there's not a lot of test to treat sites up yet. What are the best ways people can go and get that medication if they feel they need it?
So the easiest way is to have a telehealth visit with your physician, with your doctor, to understand whether you meet criteria. The EUA that was approved by the FDA for this medication is for high-risk individuals, so those that are higher risk for developing severe COVID-19, age above 65, so on and so forth, and they need to be started on Paxlovid within 5 days of testing positive. So the bottom line here for folks, if they're confused, is to talk to your doctor to see if you're eligible, and then hopefully you can get the prescription, stay home, and avoid severe COVID-19 disease, which the study results were very, very positive.
Right, they were. Have you seen or heard any reports of people just having trouble going through the correct steps in the proper channels to get Paxlovid? Sometimes
it has been a little cumbersome, but we've tried to make it easy at Trinity Health of New England. And again, I suggest using a telehealth visit with your doctor. That would be the safest route. So you don't really need to walk out of your home, especially if you've tested positive with a at-home test, and then speak to the doctor for next steps.
Looks like we have time for one more question. I want to go back to what we think we've learned from this wave. I was talking before about looking at the peaks and valleys. Obviously, we focus on how high the peaks get. I'm also curious on where the baseline level is when a lot of these waves subside. It looks like that level might be getting higher and higher. Tough to tell, but we're clearly at the point where this is never going away entirely. What do you think we know about sort of the burden, and again, the baseline level of burden this is going to have on healthcare professionals and ER doctors and nurses?
So the positive point that I'd like to make is that even if the baseline is higher, the severity is lower. We're not seeing our hospitals overwhelmed. We need to learn to coexist with this virus as we move in to the endemic stage, and I believe that's where we're headed, but with less severe burden on our healthcare system.
Yeah, and next time you come in, I want to talk about what reinfection and what we know and what we don't know about it, because again, like you said, moving into the endemic phase, this is looking like a virus that a lot of us are going to get once a year, if not maybe twice a year. What does that mean? We'll talk talk more about that next week. Doctor, thank you so much for joining us.
Thank you for having me.
Dr. Syed Hussain from Trinity Health of New England. Always great to get his knowledge, Matt. And I know you enjoy his sartorial decisions as well, as do I.